looks like you're having a grand old time.
Hi.
My name is Natasha. I'm going to be your student nurse today with Kaiser. Is it okay if I care for you today?
It is.
Okay, let's go ahead and provide some privacy and do some hand hygiene. So can I just get your full name and date of birth?
Carrie Faust, 2/18/85.
Perfect. And do you know where you are today?
The hospital.
Okay, do you know what you're doing here?
I fell off my bike.
Yeah, that's very unfortunate.
It's rough day.
Alrighty, and do you know what day it is?
It is March 7th.
Okay, so I'm just going to go ahead and get some vitals. That would include her temperature, blood pressure, pulse, respirations, and oxygen. Looking at her, I noticed that she is normal skin tone, no jaundice, she is symmetrical in the face, and so we'll go ahead and get started. We're going to do a head to toe, so I'm literally starting from your head and going to your toes.
Okay.
Have a little party down there, huh? Alrighty.
My tired dance. I do that when I'm tired.
So I'm going to go ahead and get started. I'm just going to use my hands and we're going to palpate around here. No deformities, abnormal shape, any pain when I was doing that?
No, ma'am.
Alright, and I'm just going to look at both ears if you don't mind. We're going to look at...
You can't do that. I'm just kidding.
I said if you don't mind. And we're going to see if there's any skin breakdown. Do you have any hearing aids?
No, ma'am.
Alrighty, let's take a look at this one. Perfect. No history of any ear surgeries or problems. Ever lose balance or feel dizzy?
Sometimes.
Sometimes? Okay. The next thing I would do is I just continue palpating some lymph nodes.
Mm-hmm.
And I'm going to check her carotid pulse on each side, one at a time. Alrighty, and I'm going to go ahead and dim the lights so I can check her pupils. So I'm just going to take this pencil, I'm going to have you look straight, and we're going to come in and look at her dilation of her eyes. Perfect. And then I'm going to have you follow it up and then down. Alrighty, and I'm going to turn it off and have you follow it in. Alright, so pupils are equal, round, and reactive to light. While I have this out, I'm going to go ahead and take a look at your nostrils, your nares. Any problems with smelling, anything like that?
No.
Alrighty, and I'm going to have you open up your mouth and stick out your tongue and go ahead and go ah. Any false teeth or dentures?
Mm-mm.
Alright. I notice pale mucosa. Any issues with or difficulties swallowing?
No, ma'am.
Alrighty. Next thing we're going to do is we're going to check her pulses right here in her brachial. And we got +2 bilateral. And right here at her radial. +2 bilateral. I'm going to go ahead and have you squeeze my fingers. And you can go ahead and pull me towards you and pull me away from, or push towards me, yes. And while I'm here, I'm just going to look at her nail beds and check for capillary refill on both hands, and less than 3 is noted. Next, we're going to go ahead and take a listen. Alright, so I'm going to listen to your lungs first. So every time I move my stethoscope, I'm going to have you take a deep breath in and out. So here first. Go ahead and in. And on the side. In and out. And 2 more times. Alright, lung sounds are clear, so I'm going to go ahead and listen to your heart. And I'd go ahead and listen for a full minute here at the apical. Alrighty, so lung sounds were clear, heart sounds were normal. So then I would also then go ahead and turn the patient over or have you lean forward and inspect the back, look for any skin injuries, and we'd listen again in 8 different spots on the posterior side of the patient. Alright, next, so we're gonna go ahead and lean you back. The bed was raised, by the way. I raised this hospital bed.
You sure did. You raised it and you put the thing down.
So I'm gonna go ahead and take a look at your abdomen if you don't mind. So I would pull down the blanket and pull up her shirt, and I would inspect the area first, noting any distension or abnormalities of the abdomen, and then we'll go ahead and listen to the bowel sounds. Alright, bowel sounds are present in all 4 quadrants, and then I would go ahead and palpate the abdomen from right going around, looking for any tenderness or pain from the patient. So then we continue to work our way down. I would check femoral pulses. We're going to go ahead and move the blanket, make it a little cold. Check for popliteal pulses. Oh gosh.
I know more.
Yeah, they're there. Good job. And we would take note of her skin as we examine her legs. And then we'd come down and check pulses in her leg. Posterior tibialis? Is that right?
Yeah, the other one's dorsal.
Okay. So posterior tibialis right here on the back. And then the dorsal right here. So we had +2 bilateral for all the pulses. We go ahead and check cap refill of her toes. And I'm going to have you push towards me and then pull away from you. We'd also check for any skin injuries to the heel or the bottom of the feet, and if the patient notes any pain. And go ahead and cover you back up. Alrighty. And on a scale from 1 to 10, do you have any pain? Okay. So then we'll go ahead and conclude. We bring the tray over, find out if she needed to use the restroom or have any water before I left. Raise the bed back up as well as the side rail. Here's your call light and hand hygiene. And see you later.
Excuse me, ma'am.